Hi there. Thank you for watching Sock Prairie Ambulance's January 2019 training, Pediatrics, King Airway, and Defibrillator. This will serve as the lecture portion of your training. After this, you'll be required to attend the in-person skills section as well as take the online quiz found on the LMS. So here's what we got to do here. We're going to cover things like pediatric pad placement, reminder on how to set joules on the defibrillator unit for pediatric patients when working a pediatric code. We'll review the IO placement for our AEMTs. We'll take a quick look at the pediatric kit, and also Dean will review pediatric King Airway placement with you guys. A couple of things to remember about pediatric patients and what they are. Here is our pediatric cardiac arrest protocols. These are found on page 112, 113 of your Dane County protocol books. A few things to remember when it comes down to this, and I've highlighted them on the screen here. Don't forget that you're looking at least 100 compressions a minute, going 1 to 120. Right in this, obviously, correct hand placement on the patient. When working with multiple rescuers, we're doing 15 compressions to 2 ventilations. And just kind of remember how that always works from our CPR training we did just a few months ago. If we have the advanced airway in, we're looking at 10 breaths a minute, so every 6 seconds, give or take, working with continuous chest compressions. The big part that I know Dean wanted to cover on our training was the shock energy for defibrillation, also found here on both on page 113 and over here on page 112. That the first shock given is 2 joules per kilogram. The second and subsequent shocks are going to be 4 joules per kilogram. Lastly, in our advanced airway here, we're looking at placing our advanced airway. Typically, when it comes to a pediatric call, especially for our neonates, those kind of things, an advanced airway isn't always necessary, especially in the younger children. You can usually get by with a bag valve mask and good ventilation that way. But make sure that you're looking at 1 breath every 3 to 5 seconds if you're rescue breathing with no advanced airway present. And then looking at placing your advanced airway after that potentially. So don't forget, for our purpose here, our pediatric patient, we're looking at anybody who has not reached puberty yet, males, which is underarm hair development, females, breast development. Typically, we're looking at, under age 8 here we're talking when it comes to our pediatric patients that we have. You'll find the pediatric bag, don't forget, in the passenger side front compartment. If we open it up, unzip it as you all done during your inspections. In the main compartment, you have the King Airways, our 2 size 2.0 and 2.5. Our pulse ox, which has all the extra probes to use with pediatric patients. Our C collar and X collar, Pediatape, airway kits, all those kind of things. Also, you have the color-coded bags that have been sealed. Okay, and those are the bags you're going to grab based off the color on the Pediatape. Here's the Pediatape found in the main section of the pediatric bag. Notice the colors that are placed on here, and so when you're measuring your pediatric patient, that's going to be, you're going to go towards the color, grab the pouch of the appropriate color. Also on here in Sharpie is noted what size King Airway you're going to grab for that patient as well, and the varying areas within that patient's size where you should grab for the correct King Airway. To measure your patient with the Pediatape, stretch your Pediatape out next to your patient. Starting from the black here, measure down to the head, measure down to the patient's feet, and then make sure tape is nice and tight, get the most accurate measure we can to grab the correct size equipment. That's done for all of your younger pediatric patients. Now, we're going to a pediatric code. We're looking at our pediatric pad placement. Some pads have special pediatric actuators on them. We do not carry them. So make sure that we're using our adult pads. We place them in a posterior anterior position, as you can see on the picture here to your right. We're doing that to make sure we can get the correct voltage going right through the heart, and hopefully and fixing the arrhythmia that's present. Typically try and do with our top arm pad on the front and the one to the lower left on the back, so we can shoot through just like you would on an adult patient. Because we don't carry the special actuating pads that will correctly adjust the joules for a pediatric patient, you have to manually reset the joule setting on the defibrillator when working a pediatric code. So as we said before, our initial shock is 2 joules per kilogram. All the other shocks after that are 4 joules per kilogram. Our easy formula for that, because we're looking at kilograms or metric system in one of the few countries that uses the imperial system, is take your weight in pounds, divide by 2, and subtract 10%. So a 20-pound patient, right, divide by 2 is 10, minus 1 is 9 kilograms. Okay, 1 is 10% of 10. So your first shock will be 18 joules. All our shocks at 36 joules. The problem with LifePak 15, and Dean found this out when we were preparing for this video, is that the LifePak 15 does not allow you to get the exact joule that's there. So choose the closest joule setting to your measurement, going one higher up. And I'll show you this in a second how to do this. So when you turn your unit on, it always presets or automatically goes to 360 joules. To change the joules, push the energy select button found right underneath the on button. Okay. After that, you can change the shock energy in one of 2 ways. Either you can use the button and use the little arrows to go up or down, or use the dial to go up or down to find the correct piece here. As you go forward with this, you're going to see the setting right here in the middle, and you'll see right in the little box. And after you select your energy, then you also see it in the top right here next to where the battery lights are. Remember, these have preset levels in them, so you have to get as close as you can to your right number, always going to the higher setting. Okay, so don't forget how that works. Our pediatric IO placement for our AEMTs and EMT basics who are assisting setting up an IO for your AEMTs. When you're trying to find the correct spot here, you're going to find the patella, the kneecap. Go 1 finger and slightly medial to that spot. You can see where Dean's finger is right there pointing on our patient. You can then insert your IO using the pink pediatric needle that's present, and then follow your proper IO procedure after that. Don't forget, we should be using our 60 drop tubing for infants. The IO needs to be flushed, and then we should be using a 1,000 milliliter bag within the pressure bag. To make sure you pump the bag until a little green pops up on the handle right here to tell that there's been enough pressure to properly infuse the patient via IO. Last, we're going to our pediatric king placement. We have 2 king airways for pediatrics in the pediatric bag. We have our green king airway, which is for patients 35 to 45 inches long, and we have our orange king airway for patients who are 41 to 51 inches long. Each has their own little cuff volume to that is listed on the actual airway packets as well as on the Pediatape. So for our 2.0 airway, or our green airway, we're looking at 25 to 35 milliliters, and then for our orange or 2.5 airway, 30 to 40 milliliter cuff volume, we're going to be putting into that cuff. Once again, check the Pediatape so you can find the correct airway that you're going to be grabbing. And here's Dean for a refresher on how to place that airway.
We have 2 advanced airways, the King 2, which is the green model, and the King 2.5. The Pediatape will be used for measurement, so you get the accurate measurement on your patient. There is an overlap with the green and the orange one. There is a slight overlap. Again, the process of putting in a King airway will be the same. The only difference with the King airways of this size is this does not have a suction cannulation area on you. These are too small. Again, put your head in a neutral position. Trap it between your knees if you can. You're doing a jaw lift and holding the tongue down and sliding in, and after it has been lubricated, insert it all the way down to the plastic to the teeth line. Now for the orange one here, we're going to start out at 30 milliliters. And then we will attach our ambo bag and ventilate as we're slightly pulling out, and once we have adequate tidal volume and lung expansion, we will then insert another 10 cc's to seat it. We'll ventilate, check bilateral breath sounds. Apex is your best site, and then also check your belly sounds. Secure the King Airway in place. By some means, there is a pediatric securing device in the airway kit, so you should secure it using that.
Thanks, Dean, as always. Our last little part will be our post-ROS care and also fluid infusion for our pediatric patients. Just remember, it comes to fluid infusion for our AEMTs or EMTBs that are assisting with this. We're kind of watchful of how much fluid we're putting into a patient. Remember, when we're looking at a baby, right, we're only talking about less than 500 milliliters of blood within that baby. So hypotension can happen very, very quickly. Anytime you're going post-ROSC, or if you have a trauma patient, always watch that hypotension, evaluate your blood pressure every 5 minutes. So if the patient has no previous cardiac history, we're looking at about 20 milliliters per kilogram is going to be your flow rate, maximum about 60 milliliters per kilogram. If they do have a cardiac history, because of what Dane County protocols are written, you'll be doing 10 milliliters per kilogram, and then reevaluating that BP every 5 minutes up to 2 times. We're doing this because of children having a smaller blood volume. Again, a 10-pound baby is going to have less than 500 milliliters of blood in their system. Hint, hint, quiz question. So make sure you view your normal daily infusion rates as we go forward. That's it, ladies and gentlemen. Make sure that you complete your quiz in the training LMS. Passing that quiz will get you access to your training night to do a practice on your skills, where we will do hands-on practice with studying our pad placement, joules, studying on the Defib on the LifePak 15. We'll be doing IO placement, as well as inserting our King Airway. Thank you all for watching, ladies and gentlemen, and I wish you all the best.